what gets measured gets done. Thank you very much, Mr. Lervel. Now, government. Uganda is present in this meeting at the highest level with the Minister of State. And the intention post this summit is that Africa stands out and becomes that hub, that international hub for excellence in scientific research. Honorable Minister of State for Health, Primary Care, and Member of Parliament, Honorable Sarah Opendi, will be addressing us shortly. But before she does that, I would like to say a few words about her. She's Minister of State, yes, and she has served as Deputy Speaker for Toronto District Council from 1998 until 2000. She also served in the Office of the Inspector General of Government and was promoted to Principal Inspectorate Officer in 2004. She has held roles in many other organizations, such as the Danida Anti-Corruption Project, where she was Deputy Project Coordinator, the Acholi Bursary Program, and the project of the Royal Netherlands Embassy, where she was the accountant, and Windle Trust, Uganda, where she was the financial manager. A seasoned business administrator, seasoned accountant, and seasoned politician, a human leader, a champion for development. Honorable Sarah Opendi, please speak to the summit. Thank you very much.
Thank you very much. Distinguished participants, ladies and gentlemen, it's indeed a great pleasure for me to be here this morning. And I must say a big sacrifice. For those of you who know what is happening in Uganda now, this is election time. So any minute that you are away, you are losing some votes. So I've lost 2 days. I don't know how many votes I have lost. But my being here is because I value our partnership with Merck and UNESCO. And I must first of all apologize that I will not be here long, lest I lose more, because the elections are on Monday next week. So I have to travel back tonight. So ladies and gentlemen, as most of you know, Uganda is a low-resource country with a population of 34 million people. And half of these are young people below the age of 15. Uganda as a country experiences a high disease burden of majorly malaria, infectious and non-communicable diseases. And of course, malaria being the leading cause of morbidity and mortality amongst all the age groups. HIV/AIDS has also had its toll on our population. And of course, we have also experienced the viral hemorrhagic fevers, specifically Ebola and Marburg. Right from the outset of my talk, I would like to underscore that the health sector in Uganda implements an evidence-based policy formulation and programming strategy. We do recognize that sound policies and programs, more often than not, emanate from well-researched information, critical reviews and analysis, as well as consideration of best practices. This approach leads to policies and programs that are responsive to and tailored to the local situation and needs on the ground. We therefore need, ladies and gentlemen, to make good use of quality and relevant research available to inform policy and practice. In line with the above, over the last couple of decades, Uganda has conducted health research in several areas. With the emergence of the HIV/AIDS pandemic in the early 1980s, research efforts in the country expanded dramatically. International funding and collaboration supported these research projects and different stakeholders, including those from the public, private, and non-governmental organizations. And they have been engaged in health researches And of course, this partnership created opportunities for health research funding. Ladies and gentlemen, Uganda has hosted some of the high-impact researchers in sub-Saharan Africa, and notable among them are the Burkitt's lymphoma study that showed the linkage between the tumor and Epstein-Barr virus. We had the Petra study protocol to the effect of nevirapine in the reduction of the risk of mother-to-child transmission of HIV. And I must say that this has given us tremendous success in the elimination of mother-to-child transmission of HIV, where in the last 4 years, the last data that we had about 28,000 children born with HIV/AIDS. Today, we are talking of about 4,000. And our target is that by the end of 2015, we should have no child born with HIV/AIDS in Uganda. We also had the Rakai medical male circumcision study that showed a significant reduction of the risk of HIV acquisition by circumcised men. We've also done research on the use of fluconazole to reduce the risk of cryptococci meningitis among HIV-infected individuals. I could go on and on the list, listing other studies, but of course, the list that I just read to you gives some important examples of the researches that have been done in the country. And all the above studies have since led to health policy formulation and practice, and show one of the main reasons why we have had successes and achieved our targets, as I indicated regarding the EMTCT. We have, as a country, I'd already talked about this. So ladies and gentlemen, all is not rosy with research in Uganda. The process of planning for and implementing research has had a number of challenges, and of course, one of which is implementing researches that are not responsive to the local situation. This was especially true during the time when Uganda did not have an agreed research priority agenda. Conducting researches that are responsive to local needs is one solution to this gap. We have also been having a research agenda that has been mutually agreed upon by researchers and policymakers, as well as program people in a stepping stone to quicker use of research information so as to influence policy. So in addition, having a research policy and strategic plan is a good opportunity to have this approach succeed. It's therefore important to have dialogue between researchers, policymakers, and program managers, without which any recommendation or successful researches may not be implemented. And I want to give an example. When we had chloroquine resistance that was reported in 1994, it took our program managers several years to adjust the malaria treatment policy, just because there was no interface between the program managers, researchers, and of course, the policymakers. So inadequate dissemination of research results has also been an issue. Research carried out by various players was not widely shared, and as such, their findings marginally contributed to decision-making in improving delivery. We do recognize the importance of disseminating research findings to stakeholders who need to know and put to use research findings. At times, we have challenges. People are made to give their time to participate in research, but after the completion of the research, there is no feedback provided. And this is not a good practice, and I want to urge all the other countries to avoid this. And this has been one of the weaknesses leading to gaps in translating research results into policies or programs. In light of this, I want to implore researchers to conduct researches primarily to generate information that have relevancy to the local needs. And of course, we should not forget the media. The media plays a key role in disseminating information. We also have the other challenge, the focus by some researchers to just look at publishing study results in peer-reviewed journals, as opposed to the promotion of local use of data. And of course, this also creates a gap in research in our country. Of course, majorly we have research done by the academia, whose promotions in universities, among others, are based on the number of papers published. There has also been a challenge in the engagement of policymakers by researchers. Policymakers like me have a vital role in translating research results into policy and programs. We control funds for the implementation of policies and programs. Therefore, measures that can be taken to facilitate policymakers to influence translation of results into policy provide a good opportunity. The development of policy briefs on topical research topics to facilitate input of policymakers who are often too busy is one approach that can help to promote local use of research data. We also have challenges in most of the developing countries, of course Uganda not being an exception, of lack of the appropriate technology in country to handle sample analysis work. Therefore, technology transfer to the southern countries, which usually host research work, is a solution to this. You're aware that most times we have to ship samples out of the country to do sample analysis, and of course, this also poses a challenge. Finally, ladies and gentlemen, we have the challenge in the management systems for health research. Specifically, there is weak coordination of research activities, leading to duplication of research activities in various organizations and entities. And of course, also the overdependency on donor funding for research tends to influence the type and direction of research that is conducted. So as a result, the perceived national research priorities lack support, and subsequently, a significant amount of research findings have not been routinely translated into policy at country level. Ladies and gentlemen, despite the above challenges, we have made some efforts to address them in our country. Since a national research framework and agreed research priorities are essential ingredients to facilitate use of research information, Uganda has now developed its national research framework and identified research priorities. The country has also developed its second national development plan, and this plan underscores the use of evidence-based policies and innovations. The government has also taken deliberate steps to strengthen governance and management of research efforts by providing an enabling environment for research. We have established the Uganda National Health Research Organization, UNRO, to coordinate health research in the country. This is a semi-autonomous agency that is mandated to provide leadership and management for the coordination, alignment, and harmonization of health research in the country. The agency also sets up research priorities and promotes dialogue and information sharing, and also establishes a framework for the translation of findings into policy. Furthermore, ladies and gentlemen, the health research policy and national health research strategic plan have also been developed as a basis for the conduct of health research in the country. The country has also embarked on a consultative process of updating the essential national health research agenda that is relevant and community responsive. And actions to strengthen the human resource capacity form another line of response to address the challenges. We do recognize that capacity building for research implementation at local level is very important. The already existing well-established research collaboration in Uganda involving the various research groups from research organizations and academic institutions from all over the world provides a good opportunity for us to achieve the desired capacity building. We have the Uganda Virus Research Institute, which in collaboration with Makerere University and Medical Research Council has been training the postgraduate students in research work And this linkage, we believe, will address the capacity bottlenecks related to human resource and sustainability issues. Last but not least, ladies and gentlemen, stakeholder engagement is also taking place to promote the use of research information. It's important that we engage all stakeholders so that they can be able to appreciate results from research findings and agree on a way forward. On the aspect of funding of research, some local funding for research has been identified, starting with research in the science areas. Our own president, His Excellency Yoweri Kaguta Museveni, put in place the National Millennium Science Development Fund to support research on some critical areas. And this fund is being managed by Uganda National Council for Science and Technology. And of course, researchers do access this fund on a competitive basis by writing research protocols. In conclusion, ladies and gentlemen, we need to expand collaboration and partnerships within and with other countries as a means of mobilizing human, financial, and technical support. These collaborative efforts should build research capacity for the mutual benefit of both developing and developed countries on a sustainable basis. Of course, health challenges are expected in the future. The impact of the evolving environment and climate change needs to be investigated as ecological systems are being constantly disturbed. I want in a special way to thank UNESCO and Merck for organizing this research summit that I believe will give all the various participants here present an opportunity to share experiences and gain knowledge in preparation for the development of research excellency in Africa. I want to applaud you, Merck and UNESCO, for this historic initiative. As mentioned by the moderator, we need a vaccine against Ebola. We need a vaccine against other viral hemorrhagic fevers. We need a vaccine against malaria. We need a vaccine against HIV/AIDS. And these are our major problems in Africa. Without research, we cannot make progress. And therefore, it's important that our governments do put aside adequate resources to promote research. I want to end, ladies and gentlemen, by saying, as Mahatma Gandhi said, that let's all be the change that we want to see in the world. Thank you very much.